Welcome to our discussion on irritable bowel syndrome and small intestinal bacterial overgrowth, or IBS and SIBO. This is a digital doc conversation sharing a functional medicine perspective on these conditions in particular. Before we dive in, I want to share some details regarding Align Modern Health. My name is Dr. Blake Butler, and I'm a functional medicine provider at Aligned Modern Health. At AMH, we offer integrative medicine through practices involving chiropractic and physical medicine to address your mobility concerns and pain. We also offer clinical massage therapy, acupuncture, and traditional Chinese medicine to regulate stress, anxiety, musculoskeletal function, men and women's health, and fertility. And finally, we offer functional medicine clinical nutrition. I am a functional medicine provider once again, and if you're not familiar with functional medicine, it is our intention to get to the root cause of dysfunction by looking at you as a whole person as opposed to individual parts. We want to know how the body works together, and we want to know details related to diet, lifestyle, environment, and health history that may influence your health trends. We often use comprehensive testing and use the data to guide our decision-making process as we work with our clinical nutrition team to make very personalized dietary and lifestyle changes. With that, a little bit more about me. I have a bachelor's in human biology and a doctorate in chiropractic medicine through Yoga University. I also have postgraduate training in functional medicine via the Institute for Functional Medicine and a variety of other programs in this space. I have a love for this type of healthcare, and I'm so grateful to be on this team with incredible providers who I can learn from and work with. I also appreciate the integrative healthcare environment because I don't have all the answers. So as we dive in today, know that I'm going to speak through the lens of functional medicine because that's my area of expertise. And if you have questions, please be sure to leave them in the Q&A box as opposed to the chat, as I will have time at the end of this conversation to address questions. Let's dive in. Today, we're looking at the gut microbiome, and let's talk about some anatomy first. The digestive system starts in the mouth. We work our way through the esophagus into the stomach. We have then our small intestine and our large intestine. We're going to really focus on those areas today. We then see everything released through the other end of the digestive tract. When we look at the gut microbiome, though, we know we have trillions of bacteria that make up an ecosystem of bugs that influence our digestion, but also our systemic health trends. For example, we know 60 to 80% of our immune system is influenced by the digestive tract, and we know that many diseases may start in the gut. We see a correlation with increased risk factors for inflammatory bowel disease, type 2 diabetes, high blood pressure, and colorectal cancer when there's changes related to the gut microbiome. So we really take this seriously. We also know many external factors influence our digestive pathway and our gut microbiome, specifically our dietary choices, our medication, our location or geography, and our health history related to birthing processes and so forth. We're also going to touch on stress and its influence on the gut microbiome and these conditions in particular. I'm bringing you all here today to discuss irritable bowel syndrome and SIBO because there's a strong correlation between the two. We're going to take a look at IBS first. I think it's really important to understand that IBS impacts approximately 25 to 45 million people in the United States and about 11% of the global population. That's pretty significant. And we see this often in clinical practice because most people are labeled with IBS when providers don't really understand what's going on. And they've had the opportunity to rule out celiac disease, inflammatory bowel disease like Crohn's or ulcerative colitis. So it's my job to say, why would someone express IBS-like symptoms? Is there an underlying root cause? Because I really believe, once again, this is a diagnosis of exclusion. We've ruled out everything else, so we just label someone with IBS. It is a real diagnosis, however, and we have to be mindful that there's different types of this presentation because it is a symptomatic diagnosis. We can see diarrhea. We can see urgency come with that. We also see constipation. Further, we can see concerns related to a mixed bag, intermittent constipation and diarrhea with a stressful gut. Oftentimes, people feel like they have a sensitive gut, and when they feel anxious, they may have symptoms. We can also see cramping or discomfort with this, which we're going to talk about in more detail. As we take a look at these symptoms in more detail, we've highlighted a few. We talked about the diarrhea constipation trend, but I think it's also important to note that incomplete bowel movements, indigestion, nausea can also be seen with IBS. We can also expect one to experience excessive gas and an urgent need to have a bowel movement. I really want to spend some time on that because that's important. That really influences one's quality of life. We want to ensure that we try to regulate that and establish practices to manage that because an urgent need to use the restroom can impact someone on the go. It can impact their ability to be confident in social settings. It can also influence their ability to work in different environments. So we really want to resolve that in many individuals who come with IBS-like symptoms. We also know that IBS can promote or contribute to anxiety and or depression, and we believe this is a result of the gut-brain axis. If you look at your gut microbiome, we have once again an ecosystem of all these bugs, and these bugs can either be protective or live with us symbiotically, or they can create dysfunction and inflammation. We know there's a direct immunological pathway between the gut and brain. We also know that the gut can influence our inflammatory trends throughout the body, and we're learning that anxiety or depression may be inflammation oriented. So when we look at this, we don't always or only look for neurotransmitter imbalances related to serotonin and dopamine and so forth. We have to consider the immune response of the individual in front of us, and we have to consider their gut because once again, 60 to 80% of the immune system is found within the gut microbiome or influenced by the gut microbiome. Further, we have to consider cause of IBS. I mentioned that this is often a diagnosis of exclusion, but I really believe in most cases there's a root cause that we can find. And in approximately 1/3 of IBS conditions, we can see small intestinal bacterial overgrowth. That occurs when bacteria migrates from the small intestine to the large intestine. We're going to go into great detail with regards to this condition. We also see what's called dysbiosis within the large intestinal environment. That occurs when we have an imbalance between the good bacteria or the probiotic species and the not so good bacteria that creates dysfunction with regards to our digestive pathways and our immune system response. We can see, in addition to that, food sensitivity. Food sensitivities occur when our immune system has a reaction to foods, and it does not have to be an immediate reaction as we see in food allergy. With a food allergy, we tend to see more severe, immediate, or acute reactions, whereas with food sensitivity, we tend to see concerns related to a delayed response. With that being said, we also want to differentiate food sensitivity from food intolerance. Food intolerance occurs when we have potentially SIBO or dysbiosis, in which our bacteria is actually feeding off of the food and we don't tolerate that food. We can recover from that. So know that we want to use these terms specifically, especially when we're doing testing or considering how to best make recommendations in the long run, because I don't want to restrict someone's dietary practices more than I have to. Further, we can see stress contribute to IBS, and that's a result of cortisol. Cortisol is our stress hormone. Our stress hormone influences the integrity of our digestive bacterial diversity when it comes to the probiotic or the protective species. We also see stress hormones, specifically cortisol, influence the immune response as it relates to the gut and the integrity of the intestinal lining or the gut lining, which we're going to spend a lot of time on today. Let's double click on SIBO, however. If we look at SIBO, which once again is a small intestinal bacteria overgrowth, we see bacteria within the small intestine that shouldn't be there within a large quantity. That typically creates a fermentation process in which the food we consume, primarily carbohydrates rich in sugar, drives fermentation, gas production, bloating, and discomfort. That is going to drive IBS diagnoses often. In fact, the most conservative study that I found taught me that 1/3 of IBS cases are resulting from SIBO. I've seen some studies indicate that 90% of IBS cases are a result of SIBO. So whenever I have someone come in with complaints consistent with IBS, I tend to really consider testing for SIBO. We can see different types of SIBO. For example, we can see a hydrogen dominant SIBO, in which I more often see diarrhea or urgency. We can see methane dominant SIBO, in which we more often see constipation because methane gas can slow the motility or the contraction of the smooth muscle that supports movement of the bowels through the digestive tract. That's going to be something that we treat differently when compared to hydrogen dominant SIBO. We can also see hydrogen sulfide specific SIBO, which is more difficult to test for, but symptoms often include gas, heartburn, and occasionally a sulfur-like breath. We also know that a large intestinal environment that's healthy may reduce or mitigate risk factors for SIBO, but if our large intestinal environment is not healthy, we have a higher risk for SIBO. Diet, antibiotics, our agricultural practices have reduced the biodiversity of our gut ecosystem in the large intestine, and that lack of diversity makes us see or makes us more prone to SIBO diagnoses. With that being said, we're seeing larger numbers of this in clinical practice. I'm also seeing larger numbers of IBS diagnoses in general. Oftentimes, patients are seeing me for a reason or seeing our team members for a reason. And we find that this is a gray area often in medicine, and we really can provide a lot of value if we can establish the appropriate diagnosis and target treatment to whatever presentation or type we see with regards to this underlying condition. Further, let's talk about the SIBO symptoms. You're going to see some commonality with regards to SIBO and IBS. We take a look here at abdominal pain, gas, flatulence, bloating, distension, constipation, diarrhea. We can also see heartburn or acid reflux, burping, and increased food sensitivities due to immunological changes or increased food intolerances due to the bacterial overgrowth. Further, we know SIBO comes from a variety of things. For example, we can see SIBO result from impaired motility, in which we see a lack of movement of the bowels, contributing to bacteria migrating from the large intestine up to the small intestine. That change in motility can be a result of cortisol. If you think about it this way, stress can really influence what's called our autonomic nervous system. Think autonomic, automatic. We see what's called the sympathetic response versus the parasympathetic response. The sympathetic response is our fight or flight response. If we experience or perceive stress, we tend to then shunt blood from our digestive pathways to our muscles to respond to the potential threat. Whereas the parasympathetic response promotes rest and digestion. That is where motility typically takes place. If you're in a chronic stress state, you trend towards the sympathetic tone, meaning that your body's in fight or flight far too often, and that can really change motility patterns, causing SIBO over time. We can also see changes with regards to thyroid function contribute to impaired motility. For example, hypothyroidism, which occurs when everything slows down from a metabolism standpoint, can contribute to slowed motility. So we want to make sure that we're understanding someone's thyroid health. And we also see a higher risk factor for this condition in those who are diagnosed with hypothyroidism or Hashimoto's, which is an autoimmune hypothyroid type case. And we do testing in the blood for that whenever working up someone for digestive concerns, because it's important that we have the full picture. Once again, with functional medicine, we're trying to take a whole person-oriented approach, and we know that multiple systems interact with one another, so we can't just look at one system alone. We can also see food poisoning or gastroparesis contribute to changes in motility. In addition to that, low stomach acid really can contribute to further risk factors for small intestinal overgrowth. We see H. pylori or Helicobacter pylori infections contribute to low stomach acid. This goes undiagnosed in many cases, and it's important that we screen for this if symptoms warrant testing, because this type of underlying infection can increase risk factors for certain conditions like SIBO, but also colorectal cancer. And we want to make sure that we're very mindful about managing risk factors when it comes to long-term health trends. We also see stress once again play a role in the stomach acid production. Stress can suppress our stomach's ability to produce acid, which can reduce our defense mechanism, in which we then kill off microbes or bad bugs that are ingested, found in food or water or soil, for example. We know that certain medications can also influence stomach acid. Proton pump inhibitors or blocking medications related to acid can influence our overall ability to regulate and fight these potential bad bugs that are ingested. And keep in mind, I'm not anti-medication. Medications are incredible when used appropriately, and there's a need, especially when working with gastroenterologists, to manage concerns related to the esophagus and the overall health and integrity of the structure associated with the digestive tract. But long term, we see potential consequences with certain medications. Specifically, antibiotics come to mind. Antibiotics are incredible. What an amazing finding in medicine. However, over time, I think they were used frequently to the extent where we saw potential downsides related to changes in how bugs respond to different antibiotics, but also how our microbiome functions, because frequent antibiotics can change the diversity of your microbiome. And if we go back to a statement I made earlier, a lack of biodiversity within the microbiome can increase risk factors related to the overall trends consistent with the SIBO risk factors. With that being said, we also know structural changes can contribute to SIBO. For example, scar tissue following a surgery or endometriosis can slow motility, and that can contribute to the overgrowth trends. Now, let's get practical. I think it's really important to understand that many people suffer with irritable bowel syndrome or related symptoms. And oftentimes, we really aren't getting to the root of the issue when we diagnose someone with IBS. This is an article that I thought was very interesting via the New York Times. This individual was diagnosed with IBS. For 2 decades, she was told that she had this syndrome and that she had to restrict or change dietary practices or use medication to help regulate symptoms. And she saw an integrative healthcare provider who then did further testing and found that there was actually another type of infection observed. In this case, we saw the other infection regulated from a clinical care standpoint, and the individual was able to essentially recover from the IBS diagnosis and establish healthy functioning digestion. I think this is an important article because for 20 years, the patient had to attempt to manage these very difficult symptoms that influenced every single day of her life. And with the appropriate workup through an integrative health practitioner, she was able to say, okay, I can actually get better. We can resolve this. And she was able to function at a much higher level. So I want to talk about a patient that I've had the privilege of working with. We're going to talk about Jane Doe. Jane is a 35-year-old female presenting with chief complaints at the time of our first appointment regarding abdominal cramps, gas, bloating, and constipation. She had further workup through her other providers, a gastroenterologist, a colonoscopy endoscopy was performed, and a prescription antacid was given to address esophageal irritation. The patient was really ultimately diagnosed with IBS, and she saw me with these complaints because she had heard from a friend that they were successful seeking out functional medicine care to address IBS. The patient, Jane, in this case, also attempted to remove gluten and spicy foods, but really didn't see any improvement. So in my role, I had the opportunity to recommend testing. We did comprehensive blood testing. We did comprehensive stool testing. We also did a hydrogen methane breath test to assess for small intestinal bacterial overgrowth. And this is what we found. If you take a look at this test report, you'll notice that we see a change in gas production. The hydrogen gas is outlined in the blue. The methane gas is outlined in the black. And we can see an increase from baseline after taking a solution that feeds bacteria. If you look down at the evaluation for these gases, we see a combination hydrogen and methane positive SIBO. So we had work to do. Our intention was to get rid of these gases as best as possible so that we could establish a new baseline and remove the bacteria from the small intestine to ultimately support recovery. Now, you may wonder, how do we actually get rid of the bacteria? Well, the good news is there's options. We know, for example, that herbal therapy is equivalent to an antibiotic for the treatment of small intestinal bacterial overgrowth, according to work done at Johns Hopkins in combination with the University of Pittsburgh Medical School. We see a really strong response to certain combination therapies, and we use different combination therapies based on the finding. So for example, for hydrogen-specific SIBO, we can use one therapy. For methane-specific SIBO, we can use another. Or with a combination of findings, we can design a plan that really reflects the patient in front of us. So in her case, Jane's case, I should say, we used a combination of specific botanicals and herbs to help kill the bad bacteria that had migrated to the small intestine. We did that over the course of 4 to 6 weeks. With that being said, symptoms improved. We didn't see a full reduction of symptoms, but we did make a transition to what's called a repair strategy because there's damage done following the overgrowth or infection trends. So we want to make sure that once we remove the bad, we then work to repair the damage done within the intestinal tract. And that's when we talk about what's often referred to as leaky gut. Leaky gut in the research is called increased intestinal permeability. And if you look at this representation, I think we can break this down in a way that's easy to understand. Look with me at the normal gut here on the left of the screen. If we take a look at the single cell layer protecting the external environment, which is our digestive tract, from the internal environment, which is our vascular system, you can notice the blood. We see that there's a thick layer of mucus. That mucus helps respond to bad bacteria, food particles, and viruses. That then protects our internal environment. However, if we have small intestinal overgrowth, food sensitivities, or certain factors that would break down that mucus layer, we tend to see leaky gut trends. So for example, on the right, you're going to notice very limited mucus production within this gut microbiome. We also see changes with regards to the intestinal lining. We see gaps or a transport opportunity for these bad bacteria, toxins produced by bad bacteria, and food molecules to make their way into the bloodstream. That starts to create systemic havoc, and we can see inflammation and immunological responses in the rest of the body beyond just the gut. There's a researcher called Alessio Fasano that would describe this leaky gut as a mechanism driving risk factors for autoimmunity, chronic disease, and cancer because of the inflammatory changes that occur. Therefore, we want to work very hard to treat this anytime we have any type of underlying infection or stress to the digestive pathways so that we can reduce or hopefully work to prevent chronic inflammatory conditions systemically beyond the gut. To recover from this, we know that we have to establish practices to heal this environment. But before we heal the environment, we have to know why the damage was done in the first place. And that's where the other components, i.e., SIBO, come into play. And therefore, we treat that first, and then we navigate our treatment to address this presentation, which is seen typically with these underlying infections like SIBO. I also want to take a moment here to talk about gluten. Gluten is not inherently bad. However, 1% of the population has celiac disease, in which they have to avoid gluten entirely. We also see that about 15 to 20% of the population has what's called non-celiac gluten sensitivity. We see this contribute to further risk factors related to leaky gut or increased permeability. We also see gluten looks similar from a structural standpoint to our thyroid tissue and our cerebellum. The cerebellum is called the little brain. It's involved in balance. And in the research, we see what's referred to as glutentaxia, in which we lose balance or we have coordination concerns resulting from our consumption of gluten because our immune system gets confused. And through a process called molecular mimicry, we start to then have an immune response directed towards our own cerebellum, which is basically our balance center. That's an oversimplification, but I think it's very, very interesting to see how a food protein can contribute to brain-related changes. We also see a correlation with Hashimoto's, which is an autoimmune hypothyroid trend, and therefore some people removing gluten can influence Hashimoto's. We don't cure Hashimoto's, but remission may be possible if we do treat the gut, heal the intestinal lining, and make the appropriate dietary changes over time. So let's talk about how to fix this. If we take a look at leaky gut repair, we know we need to manage stress. For example, I mentioned that cortisol would influence the integrity of the microbiome and the mucus production to support the immune response in this case. We also regulate sleep. Sleep, specifically a lack of sleep, can be a significant stress to the body. We also see a lot of repair occur during our phases of sleep. We know that prebiotics found in food, specifically fiber, probiotics found in fermented foods or via good supplementation, and postbiotics can influence the health and diversity of our microbiome. I want to take a moment to talk about postbiotics. You might not be familiar with this term. This is actually the byproduct of feeding good bugs fiber. These postbiotics help reduce inflammation. They also help support our overall gut immune system response. We know postbiotics are often referred to as short-chain fatty acids, and we can actually use them clinically in the form of butyric acid to support the recovery of an individual with suspected leaky gut. Bone broth, L-glutamine, zinc, vitamin A, aloe, and a variety of other factors can also improve or support the health and integrity of the gut environment. So we often design plans based on the collection of data from that individual. We also consider their dietary preferences, their environment, and their lifestyle when working to repair this. This is a key component to care because if we don't repair the damage done, the individual, Jane in this case, is at a high risk of a SIBO re-aggravation. So we want to work very, very hard to ensure that we are managing damage done related to the microbiome or the intestinal lining to prevent the re-aggravation of SIBO or IBS-like symptoms. So I really prioritize this in treatment, and this often takes longer than the actual removal of the bad bacteria. So in this case, Jane worked with me for approximately 3 months. We did a follow-up round of testing to take a look at her SIBO trends after working through the therapy to remove the bad bacteria and to repair the suspected leaky gut or increased impermeability, as you'll see more scientifically. With follow-up testing, we saw in Jane's case a significant improvement related to the hydrogen and methane gas trends. You'll notice her hydrogen went down to the normal reference range. Her methane also went down to the normal reference range. We wanted to continue to improve on methane gas. I like that below 3. So we did some continued work to drive better motility. And a lot of that came through continued stress regulation, sleep, and lifestyle prioritization. And we have seen considerable long-term improvement in Jane's case. And Jane was indeed very happy. With that being said, I hope this highlights what a typical experience looks like regarding functional medicine care as it relates to IBS or SIBO. Keep in mind there's other causative factors that we want to be thoughtful about. I want to use as well this time to address any questions you may have regarding this topic of discussion or anything that I brought up. Please continue to type the questions in the Q&A box. We'll do our very best to get to as many questions as possible. If I do not get to your question, please forgive me. We do offer personalized free 15-minute consultations. You can reach out to our team via the information found here. And at this time, let me take a look at my other monitor so that I can start to address some of these questions. So the first question asks, will we discuss strategies with regards to repairing the mucosal lining of the digestive tract? And the answer in this case is absolutely. Some of the strategies that we outlined regarding the leaky gut repair actually influence the mucosal lining. One specific therapeutic intervention that I really like is what's called the introduction of serum-derived bovine immunoglobulins. These immune proteins can actually really help support the health and integrity of the mucus response and the mucus lining within our own gut microbiome. So oftentimes we'll use those clinically to support one. Colostrum is another term that's often utilized, but I often use a non-dairy component of the colostrum, specifically derived from blood. So we can use different therapies to try to support the mucosal lining. We can also use lifestyle behavioral changes to help regulate that. Another individual asks, are sugary foods and drinks the worst thing to consume for gut health since sugar feeds bacteria? And I think this is a great question, and I'm glad you bring this up. We know that sugar can feed bad bugs, specifically added sugar. Think about the consequence of bloating in some cases when you consume a very sweet dessert or sugar from a liquid form. That is often a result of feeding bad bacteria. So sugar is not the enemy per se, but we do often need to remove added sugar, or reduce our consumption of added sugar to stop feeding the bad bugs, to then allow for us to get rid of the bad bugs, to create a healing process, to then improve tolerance to sugar in moderation. Sugar has other inflammatory influences in the body, and we can talk for hours about that, but I do think it's an important piece during treatment. We work with dietitians to make sure that we have the ability to make the appropriate adjustments from a dietary standpoint, but we also work to create sustainable plans after we've made the adjustment regarding the sugar consumption. In addition to that, someone else asked, is it better to get probiotics naturally through food, or is it better to supplement probiotics in pill form? And this is a great question. I really like to get our probiotics from wild fermented foods. Think kimchi, kefir, pickled vegetables, for example. However, with an underlying IBS diagnosis or potential SIBO, in some cases, probiotics can make things worse symptomatically because not all species or strains of probiotics from a food or supplement standpoint can be helpful. So oftentimes we reduce our consumption of certain fermented foods for the short term to then work towards slowly reintroducing them in the future. We also use very specialized strains of probiotic species that are typically IBS or SIBO safe when supporting the recovery. So that's where working with a provider who's really knowledgeable on this treatment can really change our response to probiotics, because probiotics are not, unfortunately, a cure-all. Another individual asks, can leaky gut be fully restored? And I think this is really important to note that we can really create significant change regarding leaky gut trends. There's benefit in doing some comprehensive testing to get to the root cause so we can pull the thorn from one side, i.e., remove SIBO. And then if we introduce the appropriate recovery strategies, we make the long-term appropriate lifestyle and sustainable changes, we can really improve the integrity and health of the gut lining and the mucosal response to then make that individual more resilient. So this is something that we can really work to recover from. We do have to be mindful about environmental factors, stressors, and it often requires some long-term maintenance from a dietary lifestyle standpoint, but we can really improve our ability to respond to this. Another question relates to chronic constipation. This one is more personal as it relates to how to navigate chronic constipation or IBS-C. I would recommend a complimentary consultation so that we can get more nuanced with the response. Our teammates can really dive into this in great detail because there's a lot of questions that I have to understand why someone is chronically constipated. We talked about a variety of things influencing motility. There's certain strategies that can be helpful to support bowel movements, but I don't want to give any blanket recommendations because there's a lot of nuance that comes into the treatment recommendation, especially as it relates to constipation. Another question asks, how do we know what came first, SIBO or leaky gut? I wish I knew. I suspect in many cases that SIBO would come first. However, leaky gut can also make the individual more prone to a SIBO diagnosis. So we know that there is a potential correlation between the two, but causation becomes a question. I often see SIBO first clinically, and then I suspect and treat leaky gut. But if I know someone has a history of SIBO, food poisoning, food sensitivity, or other factors, then I have to assume potentially leaky gut came first, and that created the environment in which they were more prone to developing a condition like SIBO or IBS. So great question. I wish I knew as well. I think it's going to be very individual, and we have to have a lot of context to make that decision together. Another question, is it possible to cure SIBO alone with stress management? Interesting. I think stress management, if stress is a causative factor, is very important. It's a key component to my care recommendations. Acupuncture, for example, is an excellent tool to support stress management. We also find other techniques through meditation, mindfulness therapy, great tools to support stress management. But in my experience, once the SIBO has developed, we actually have to intervene clinically. We can't only rely on behavioral stress-related changes. It can be helpful, but we usually have to treat the clinical presentation that resulted from stress. And then in the long term, we can see more resilience and an improvement in our ability to prevent SIBO with stress management. Another individual asked, can you get SIBO more than once? And the answer is unfortunately yes. We can see SIBO recur. In fact, it's known to happen time and time again in some individuals, and that's often a result of maybe not going through the appropriate recovery strategies from a care standpoint. I spent a lot of time today going over the repair or recovery strategies, and that's because I want to work with people to get them to the point where they don't have to see me again for SIBO or these underlying IBS type symptoms. So yes, it can recur and it's known to do that. Oftentimes, if you catch it early, if you have an aggravation, we tend to be able to direct care more specifically to that, and we tend to see quicker results with a recurrent aggravation. Another individual asks if there is a connection between IBS and multiple sclerosis. And that's a difficult thing to discuss because multiple sclerosis is complex. It's a neurological condition impacting myelin. And with that, we know the gut may play a role in the development of neurological or autoimmune type presentations, but I wouldn't state that there's enough evidence to state that there's a causation component. I suspect that there is a correlation and it plays a role in a multitude of factors, genetically, environmentally, and gut microbiome related that would influence the onset of progression of MS. When I'm working with an individual who has or was diagnosed with MS, we often look to the gut and treat the gut in great detail to do our very best to regulate the immune system, because I treat that almost as if we're supporting a neurological autoimmune type presentation. I also co-manage with neurologists and other physicians because I think there's so much value there. Acupuncture comes to mind here. Chiropractic and physical medicine comes to mind here to create a healthy stress response to support mobility and movement and musculoskeletal function. So that's a really great question, something that we usually work with a team to support. And I've got time just here for a few more questions. Another individual asks if there is any correlation between IBS or SIBO and the development of fibroids, specifically uterine fibroids. And similar to the MS-related question, there is potentially a correlation. We see changes with regards to the microbiome influence our ability to metabolize or detoxify estrogen fragments. We can see that potentially contribute to risk factors related to fibroids. We also know inflammation plays a role in uterine fibroid development and management. And we talked about the correlation between the gut and inflammation. The bad bugs may produce what are called toxins or lipopolysaccharides that can create inflammation beyond the gut. So absolutely, we do treat the gut and we look to the gut when working up some with concerns related to fibroids because of the complexity as it relates to hormones and the relationship to the gut. We also have another question on a parasite cleanse. And I think this is an important question because I've had a lot of patients over the last, let's say, 6 to 12 months come in with this question. And I suspect that there's a lot of information out there on social media or potentially online recommending parasite cleanse. And if necessary, a parasite protocol or treatment can be very, very helpful. But in reality, in my experience, I do a lot of stool testing and I don't very often see concerns related to a parasite infection. We also see other trends much more commonly that would contribute to digestive dysfunction. So I'm a little bit hesitant to recommend everyone do a parasite cleanse based on information online. I really prefer personalized recommendations according to lab data and a nuanced conversation with a physician who specializes in this form of healthcare. So there is a place for it, but I would really recommend working with a provider because if we do many therapies that remove, we could potentially create a change in the diversity of the microbiome, which could increase other risk factors. So we want to make sure that we're using therapies appropriately and targeting the therapy to that individual. So that's my response to that. I think that's something that we should be mindful of. It can be helpful, but we shouldn't rely on that for everyone. And oops, my apologies. It looks like I hit the wrong button here. Keep in mind, if you have any questions as it relates to this topic of discussion, please reach out to our team. I have shared the information here regarding that. And if you want to reach out to discuss in more detail where to go from here, you can find that information at alignmodernhealth.com. You can also request a complimentary consultation across any one of our individual practice lines. And I really do appreciate your time and your questions. We have a lot of additional questions. I'd love to get to them all, but I want to make sure that I'm respecting your time as well. Once again, here's the information regarding that. We do accept insurances, most major insurances in this case, and our team's happy to look at that with you. And I, once again, am so grateful for your time here. I'm so thrilled with all the questions too, and I would love to answer each one individually. So please do reach out. Thank you, everyone, and I will look forward to seeing you at our next digital doc.